Bismillahirrahmanirrahim. I'm Dr. Imran, Assistant Professor Community Medicine. Today we will discuss measles, which is also called rubeola. It's different from rubella, which is also called German measles. Later on, when we will have a lecture on rubella, we will discuss also different what is the difference between German measles and measles, or rubeola and rubella. Going into the historical background. Initially, uh, measles, it was described by Abu Bakr Razi. He was a Muslim philosopher and medical personnel. Uh, he was very a renowned person due to the treatment of the smallpox and general measles. Later on, measles was described by the one of the medical person, Danish medical person, Penham. He went to the island and studies the cases of the measles, which were common in the persons of those islands. He specified that although the island is very far from other countries, so it's safe, but whenever any outbreak occurs, there are a lot of chances that most of the persons will be affected within the territory of the island. Later on, measles virus was isolated by Enders in 1954, and first trial of measles vaccines was conducted in 1958. In 1963, measles vaccine was licensed in America, and it was it was live vaccine and initiated in the America for the vaccination of the children. Before the vaccination became available, measles killed 7 to 8 million children per year globally. Occurrence in winter season, although it occurs most of the period in the year, but it's most common in winter period, because most of the people or children, they live in crowded place, and there are a lot of chances that if one person is infected, or one child is infected, uh, he or she can transmit that virus to most of the children who are coming in touch with those children. And it has a 90% chance that if one child is infected, there are 90% chances that whenever that patient comes into the contact with other children, 90% of the children will be affected, or that disease will be transmitted to 90% of the children. Epidemics occur when susceptible children proportion 40%, and it is endemic in virtually in all of the world, especially underdeveloped countries like African and Asian countries. 100 to 400 times more fatal in preschool children of developing countries as compared to developing countries. And 400 times it's fatal in undernourished children as compared to well-nourished children. Globally, 30 million children per year get measles, and 1 million die due to it. Measles morbidity before being measles vaccination. Measles causes 2 million deaths, up to 60,000 cases of blindness annually worldwide. From 2000 to 2015, measles vaccination prevented an estimated 20.3 million deaths. Means after the introduction of the measles vaccine, during this period of 15 years, around about 20.3 million children, other people, uh, they are saved from the death due to the measles. Measles is still leading cause of the death among children. 400 children die per day from measles infection globally. In Pakistan, 2.1 million children, they are annually being affected by the measles, and 21,000 children, they died due to the measles and its complications, mostly due to the pneumonia, which is most dread complication of the measles. National measles vaccination coverage is 62.6%, although it's old, but it's exaggerated figure. The right figure might be around about 50 or below. Now, health system, health government is they are trying their best to strengthen the routine EPI and increase the coverage in children under 5 children. Daily 58 children die in Pakistan due to the measles. Case definition: an acute illness is an acute condition and with fever 101 degree Fahrenheit, cough, coryza, conjunctivitis, and nasal discharge, followed by dusky red maculopapuration. Face starts from face and head and then gradually moves to the trunk and other body extremities. Diagnostic modalities are typical in developing countries where it's endemic. The diagnosis typically is made by rash and complex parts through signs and symptoms. But in well-developed countries, it's done by IgM antibodies where it's not common. Uh, some of the characteristics of the virus is that it's spread by breathing virus containing droplet or by touching contaminated surface. It can be transmitted through droplet and whenever a child who's infected touches any object and other children they are using, it can be transmitted through the other objects also. The virus grows in cells of the back of the throat and lungs. Symptoms appear after 10 to 12 days of the exposure. Infected person has a fever lasting 2 to 4 days, followed by the cough, runny nose, and red dusky and redness of the eyes. This especially occurs in the prodromal stage of the measles. A rash lasting 5 to 6 days appear above the face and head and spreading through the torso to the hands and feet. And last, the virus can be transmitted from 4 days prior to and 4 days after the appearance of the rash. Later on, when we will see a diagram, we can easily understand the stages, how it gradually increases or moves to the body extremities. There are three stages in the natural history of the disease. First is prodromal or pre-eruptive stage with minor signs and symptoms. Second is eruptive stage. Third is post-measles stage with mostly with complications and recovery phase. Or if complications increase, then a child can go into the uh, serious condition or up to death. Here is the diagram. From diagram, you can understand the different stages of the measles. First is incubation period. From exposure to up till 10 to 12 or 10 to 14 days, incubation period occurs. Means after 10 to 14 days, appearance of signs and symptoms will occur. And during this phase, gradually multiplication of the virus occurs in the body. The second stage means first stage, say incubation period is not counted in any stage. Prodromal period which lasts for 3 days. In prodromal stage, high grade fever, cough, coryza, and conjunctivitis these occurs, and also coplic spot appear, bluish spot appear, buccal mucosa. These signs and symptoms mostly occur in the prodromal period, which lasts for 3 days. After prodromal period, uh, normally occurs the eruptive period, which is called exanthem. The prodromal period is called enanthem because it occurs entirely in the body. Exanthem occurs on the body, skin, or surface, which lasts for 4 days, and descurate maculopapular rash appears, especially initially on the face and head, gradually moves to the body, trunk, and extremities. After this phase occurs, recovery 10 to 14 days, and if a person survives, he gets lifelong immunity, which provides protection from measles for the whole of the life. If there's no recovery, then the person or child can go into the complications, which can be deadly for that patient. In measles, it affects lungs, intestine, and brain, which can cause pneumonia and diarrhea and encephalitis. If untreated or become serious, it can cause death. It can suppress immune system. Due to the suppression of the immune system, bacterial superinfection occurs, which can cause otitis media and diarrhea and other conditions. Subacute accelerating. This is the worst condition which may occur after many years of the measles. And mostly these complications occurs in young infants or child whose immunosuppressive or immunity of their child is weak. In prodromal stage, it begins 10 days after infection and lasts until 14 days as told in the diagram. Fever, sneezing, nasal starch, cough, redness of eyes, lacrimal photophobia, vomiting, diarrhea occurs. Normally, complicated spots, these are small bluish white spots on red base smaller than head of the pin appear 1 to 2 days after appearance of the rash on the buccal mucosa, opposite the first and second lower molar. This is the redness of the eye. Uh, a bluish macular rash on the buccal mucosa. Bluish macular rash occurs on the buccal mucosa. Second stage is eruptive stage. A typical desiccated maculopapular rash begins behind the ears. Spreads, spreads rapidly over the face and neck. In the few hours, progress to the lower extremities within few days. Rash fades in the same order of appearance, leaving a brownish discoloration which may persist for 2 months. Like first, rash disappears from the extremities, trunk, and last stage from face and head. The second sequence, when it starts behind the ear, along the hairline, face, neck, chest, back, and abdomen, limbs, hand and feet in last stage. This is a typical presentation of the measles. Appearance of the rash on the face, appearance of the rash on the face and trunk. This is the one of the picture of the measles cases, redness of the eye and rash on the face. Third stage and last is post-measles stage. Child loses weight and remains weak for a few days. There's increased susceptibility to other bacterial infection and viral infection due to the suppression of the immune system. Maybe growth retardation, diarrhea, candidiasis, reactivation of pulmonary TB. Many children develop vitamin deficiency, which may lead to keratomalacia and blindness. Now, epidemiological determinants here we study interaction of the agent, host, and environment. So first we will see agent here. Measles is caused by RNA paramyxovirus, and there is only one serotype of this virus. Means due to this, we have a very effective vaccine available for the prevention of the disease. If there are so many serotypes, it's very difficult to develop a vaccine for their disease, like hepatitis C and HIV and other diseases. It cannot survive the human body, so we can easily treat this measles if we take prompt and timely actions for the control of the disease. Rapidly inactivated by heat and light, retains infectivity when stored at sub-zero temperature. So this vaccine is also kept on sub-zero level temperature. Here is a picture of the diagram of the measles virus. Epidemiological determinants, we are now discussing agent. Only source of infection is case of measles. No known carrier stage occurs in this, so it can only transmitted from the cases to the other non-cases. Secretion of nose, throat, and respiratory tract they are infective materials, and the virus can be transmitted through these secretions to non-infected children or persons. Transmission person to person by droplet infection and droplet nuclei. Porter of entry is same respiratory tract. Infection through conjunctivitis is also possible, but in rare cases. Incubation period is, as we already discussed, from 10 days up to 14 days appearance of the rash. Artificially induced measles has a short incubation period, 7 days. So, due to this, if any person gets exposure to the vaccine, if he or she is vaccinated within 3 days, uh, that person is prevented from the development of the disease and its complications. Vaccine in vaccines, we get immunity within 7 days, which occurs in normal natural infection. It occurs after 14 days of the infection. Epidemiological determinants: period of communicability, higher infection during the prodromal stage and the time of eruption, 4 days prior to 5 days after the rash. Isolation of patient for a week covers the period of communicability. So when any person is diagnosed with measles, he or she is isolated for the period of the incubation period, so that it cannot be transmitted to other persons who are non-infected. Secondary attack rate is 90%. Infection confers long-term immunity or lifelong immunity. In epidemiological factors, if we discuss the host factors, how it affects the host, let me tell you that agent, host, and environment. When they interact, then there are chances of the disease transmission. If there's no interaction, but presence of these three factors means agent, host, and factor and environmental presence does not initiate any disease, but their interaction initiate the disease. So if interaction of agent and host occurs, but in absence of the environment, then there's no any chance of the disease transmission. It's very necessary that there should be interaction of agent, host, and environment, not merely only the presence. So in host factors, it mostly occurs from 6 months to 3 years of in developing countries, above 5 years of in developed countries, because it's in developing countries immunity of children is low, so it occurs mostly from 6 months to 3 years. Equally occurs in male and in females. No, it is immune if there was no previous exposure or previous exposure to the disease. Infants are protected by natural antibodies up to 6 months of age. Up to 6 months, there's no need to need any vaccination for the children, because the maternal antibodies they produce, they protect the children from the infection. So up to 6 months after birth, their baby is protected through the maternal antibodies. Immunity after vaccination is lifelong. If either it's a natural infection when a person is getting, or he or she is vaccinated after natural or vaccination, and that person is protected for lifelong from the infection. Host factors may nutrition measles is very severe in malnourished children. It's 400 times higher in malnourished children as compared to nourished child. Malnourished child exceeds the measles virus for a longer period of time. Last is environmental factors. Virus can spread in any season, but most commonly occurs in winter and spring season. As already told, due to the overcrowdedness of the population. They are living together in the crowded places during the winter season. In general, the less favorable the prevailing socio-economic condition, the lower the average age of the children. In lower socio-economic condition are in children with immunocompromise, it attacks early in or young infants and babies and develop the disease. Another diagram with incubation period and disease period. Incubation period, virus growth and multiplication occurs in lymph nodes and goes to the body surface. Virus grows on body surface and multiplication occurs. In disease period, coupling spot and rash appears. Respiratory disease occurs and pneumonia and other candidiasis and pulmonary TB may be occur due to the suppression of the immune system. After that, a person can go into the recovery, disability, or death. There are only three possibilities after this disease. Complication, pneumonia, which is 90% life-threatening condition, mostly 90% of death occur due to the pneumonia related in measles. Uh, it less common in developed countries due to the high immunity in those children and persons, and most common in the developing countries. Otitis media occurs in 5 to 9% of the cases. Febrile conversions are also occur, and encephalitis 1,000 cases may also occur. Subacute sclerosing pain encephalitis is a rare complication which occurs after many years of the disease, possibly due to the persistence of the virus or less immune system in that person. It might occur after 7 to 10 years and uh, very severe. It may cause very severe complications, and a person may go into the coma and or in death situation. High level of measles complement fixing antibody in CSF and CRF. Frequency is in 1 in 300,000, but in recent studies, the frequency is more common as compared to 1 in 300,000. It has appeared in 2 to 3,000 per one case uh, of the SSP. Prevention of measles fall of this is very important for the break of the transmission and to go for the elimination and eradication of the disease. Worldly, they are planning after polio. So, follow guidelines are important. Achieving an immunization rate of 95%. They are maximizing the first achieve immunization of 95% and ongoing immunization against measles through a successive generation of children, which is like in Pakistan, it's done through the EPI program, extended program on immunization. Prevention of measles is occur through pre-exposure, exposure, and post-exposure exposures. Prophylaxis uh, third is control of patient. If any person is infected, what actions can be done and to safeguard the contacts and what is the role of environment in this. Epidemic measures, what can be taken, epidemic measures, national measures and international measures. So first is exposure prophylaxis. This is done through the especially vaccination, which is available in Pakistan. This is part of the EPI program, uh, and first dose of this vaccine is given at 9 months, and second dose is given at 15 months. This is a single vaccine which is given, but in other countries, uh, it can also be given through combination like MMR and MMRV. Uh, MMR is a vaccination initiated after 1970s, and MMRV is initiated in America after 2000. Uh, but most commonly used vaccination is single measles vaccine, which is in Pakistan. One dose of vaccine is about 95% effective at preventing disease. Second dose provides immunity up to 97%. Some say 99%. Time of vaccination can affect effectiveness like infants are at greater risk and children with low immune system. So it's very critical that time of the vaccination. Like in Pakistan, the vaccine is given at 9 months for first dose at 9 months. So because up to 9 months, mother antibodies they protect the child. But in outbreak situation, this vaccine can be given prior to 9 months. Means it can be given at up to at 6 months first dose. Uh, and in Pakistan, second dose is given at 15 months. But in outbreak situation, if first dose is given at 6 months, then second dose can be given after 1 month of the first dose, means at 7 months. Or first dose, if first dose is given at 8 months, the second dose can be given at the 9 months. So minimum 4 week gap is very necessary between first and second dose. Measles vaccination tissue culture vaccines available in chickpea embryo and HTCV. Freeze and dried heat stable vaccine maintain potency for more than 2 years if it's kept at 2 to 8 degrees centigrade. Means it's potent for up to 2 years. If cold chain of that vaccine is maintained from 2 to 8 degrees centigrade. Timing very important for vaccination. Immunization before 9 months of age may make it ineffective due to the presence of maternal antibodies. Immunization after 9 months means a person can be prone to any infection if that child is contacts virus after 9 months. If vaccination is not given at the 9 months. So WHO EPI program in Pakistan, it's given at 9 months first dose. Second dose is given at 15 months. This is same. This can be lower to 6 months if there is measles outbreak in the community. For infants immunized at 6 to 9 months, second dose and at the 9 months. 4 week of the gap is very necessary between the first and second dose. Administration is given subcutaneous in 0.5 ml, and it can be given as a reconstituted vaccine. Should be kept in ice from 2 to 8 degrees centigrade. Uh, in reactions, some children can get fever and rash, which lasts for 5 to 10 days, but no any serious complication occur from the vaccination. Vaccine provides immunity even to severe and malnourished children. Immunity develops 11 to 10 days after a vaccination. One dose gives 95% protection. In immunocompromised children, immunity develops in 11 to 12 days, but in normally in well-nourished children, if they are vaccinated, immunity develops within 7 days. Means of 7 days. So there's a little bit difference between of days between well-nourished and well-nourished children. Susceptible contacts over the age of 9 to 12 months may be protected if vaccines given within 3 days of the exposure. Contraindications are it cannot be given in pregnancy and acute illness or deficient immunity, immunocompromised patients or patients taking steroids or drugs. Adverse effects, toxic shock syndrome, if cold chain outlet vaccine is not maintained uh, or it's opened again and again, or whole of the vial is not used within 4 hours, and after 4 hours, if it's used, then it can cause toxic shock syndrome, and child can uh, develop severe watery diarrhea, vomiting, and high-grade fever within few hours of the vaccination. But toxic shock syndrome can be managed very well. It's not a deadly condition. It is already told you that it is also available in combined vaccinations like MMR and MMRP. There was a study on small scale that MMR causes autism, but on large scale, when this study was conducted, there was no association between autism and MMR vaccines. This was all about the pre-exposure prophylaxis. If a person comes in touch with any infected person, what actions can be taken, what management can be done, that all comes into the post-exposure prophylaxis, like active immunization. If a person is coming into contact with the infected person, and he or she is vaccinated within 3 days, and then that person is protected from the measles, from development of the disease. Basic immunization can also be given, but nowadays basic immunization is not used due to the availability of live alternative vaccine, which is very effective. Control of the patient contact and environment. Control, like if a person is getting disease, if a person is suspected of having a disease, that person is kept in quarantine. But if a person is diagnosed with a disease, that person is kept isolation. Uh, Difference between quarantine and isolation is that in quarantine we isolate the person who is suspected of having a disease, or suspected of having a contact with the diseased person. That person is isolated for the period of the incubation period, that is called quarantine. And during if a person is confirmed of the disease measles case, then if that person is isolated from other person, that is isolation. Nowadays, when we see that corona is common, and quarantine used quarantine is specifically used for the suspected cases, whom we suspect that that person which was in contact with the diseased person may get infection, and that person is um, isolated for the period of the incubation period. Uh, in control measures in environment, isolation for 7 days after onset of the immunization of contacts within 2 to 3 days, because immunity develops within the 7 days of the vaccination, before the onset of the disease signs and symptoms. All cases of severe measles in high CFR should be given vitamin A, as many cases develop acute deficiency of vitamin C. Due to vitamin A deficiency, that patient may develop keratomalacia or night blindness. Epidemic measures, these are prompt actions in which whole of the population is immunized to break the chain and control the disease. Prompt immunization at the beginning of an epidemic is essential to limit the spread of the infection. And our national measures endorse the measles mortar reduce goal. Pakistan has committed on different forums to control the measles disease. International measures, they are the control and outbreak prevention and elimination. Fourth is also eradication, which later on can be done. But difference between elimination and eradication is that elimination is done when a disease is there's a zero case of any disease at a large geographic area or many countries. But eradication occurs when there's zero case of any disease globally in whole of the globe. So it's called eradication. Globally, only smallpox is eradicated, but measures are being taken for the elimination of the polio and measles. Later on, measles can be eradicated. First, it should be eliminated at the geographic level. So, on control measures means reduction of the incident to an acceptable level. Means the disease will be present in that geographic area, but it will be no longer a major public health problem. Outbreak prevention means to break the chain, to increase the cases in any specific area, in any specific time period. Elimination, I already told that reduction of incidents to zero as a result of deliberate effort, requiring continued control measures in any geographic area. WHO measles elimination strategy occurs with three strategies: catch up, keep up, and follow up. In catch up means from 9 months to 14 years, all the children they are vaccinated. Either they were already vaccinated or not, but they will be vaccinated in catch up campaign, and they all will be covered for the vaccination strategy. Keep up is that routine EPI coverage, which is done normally, and normally children are vaccinated at 9 months and 15 months. Follow up is done after 2 to 4 years to target the children who are born after the catch up campaign. So normally these are the three strategies: catch up, keep up, and follow. Uh, and last slide, this was last slide for the catch up and keep up and follow. In last, if we summarize it, measles is a major deadly disease in the children and highly contagious, which is transmitted from one children up to many children. There's a 90% chance that one person can transmit the disease to other children who are coming into contact with that person. And there's a highly effective vaccine available, which is when it is given first dose, it may protect up to 90% of the children. Means out of 190%, children will surely be protected by this vaccine. So if uh, uh, large measures are taken and systematic approach is taken, the measles can be controlled, eliminated, and eradicated from the whole globe. Thank you so much.